Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We have a lot of topics today, including appointments to the new administration, to which we object, and some reproductive healthcare news out of Texas, which is not good, and some news about chocolate, which is good. But before we get to that, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter on Substack. You can go there, and all of the links to the medical studies, medical reports, lots of references for organizations that support reform to healthcare, and what to do in case you need an abortion or you need to fight a claim that's been denied, or all kinds of stuff. All in the newsletter. Subscribe for free. I take no money for this. Okay, let's get started. Let's talk about chocolate first. Eating more dark chocolate was associated with a lower risk of type 2 diabetes, an analysis of prospective cohort studies has suggested. Among the participants across 3 studies of healthcare workers, those who consumed servings, at least 5 or more servings of dark chocolate a week, guess what? They had a 21% lower risk of type 2 diabetes compared with those who never or rarely consumed dark chocolate. This is according to Dr. Ki Sun at the Harvard T.H. Chan School of Public Health in Boston, and the Boston Medical, BMU, I think it's the Boston Medical University. They have published the report, and there's a link to it in the newsletter. So this is no fooling around. This is from a reputable organization. There was no significant association between the consumption of milk chocolate and type 2 diabetes, so that's too bad. But intake of milk chocolate was positively associated with weight gain, where, get this, eating dark chocolate was not associated with weight gain. There's a link to the MedPage Today's story about this as well. All I've got to say is, woohoo, I'm getting a candy bar. I want to talk about scaling contraceptive access in primary care. This is a meeting that's coming up on December 18th, 2024, 10 in the morning Pacific time. I signed up. If you're interested, you should too. The link to sign up is actually in the newsletter, and if you like, I'll put it in the YouTube description box as well. Join the Primary Care Collaborative and Upstream USA for a conversation exploring challenges to providing contraceptive care in the primary care setting and solutions for overcoming those barriers. I want to give a shout out to the organization Save Secular Healthcare. And if you go to my newsletter, there's a link where you can sign up to their newsletter for free. They're the ones that shared this with me. On December 18th, the Primary Care Collaborative will speak with experts to explore the current state of contraceptive access in the U.S., the role that contraceptive access plays in the broader health arena and how it affects outcomes, and why primary care is uniquely poised to deliver high-quality, patient-centered contraceptive care. Here are some of the speakers. Jess Marcella, who's the former Deputy Assistant Secretary for Health and Human Services, Office of Population Affairs. This is high-power stuff. Dr. Angeline T., who is the Wellstar Douglas Family Medicine Residency Program. She's in that program. And she's an upstream clinical advisor. And Dr. Julie Strasser, who is the director of the Jacobs Institute of Women's Health at George Washington University. The moderator will be Ann Greiner, who is the president and chief executive officer of Primary Care Collaborator. Again, I'll put the link to register in the YouTube description box or get it in my newsletter. Texas reproductive health shame. This is just a shocking story. Texas Attorney General goes after an out-of-state medicated abortion provider. Texas Attorney General Ken Paxton has filed a lawsuit to enjoin, that's to stop, a New York physician, Dr. Maggie Carpenter, from her lawful telemedicine practice, which includes prescribing abortion drugs that can be delivered by mail. in Texas versus Marjorie Daly Carpenter. And I have a link to the lawsuit in my newsletter if you want to go read it. Paxton asks that a Texas state court judge stop the doctor. He claims, in an argument that could, by the way, be logically extended to restrict out-of-state doctors from treating Texas residents, even if they physically travel to see them out of state, that her telehealth practice in New York can now be regulated by the state of Texas. There's a link to the lawsuit. And I want to thank Joyce Vance in her newsletter the week ahead for providing this. It sounds like a BS argument, but they are on the rise, BS arguments, and the court system is no longer a level playing field. After all, that felon Trump should be in jail, and where is he? Okay, let's talk about polio on the horizon again. This is another story that is not good, and I need you to take action about this one. A lawyer affiliated with Trump's pick to lead the country's top health agency, Health and Human Services, RFK Jr., has petitioned the U.S. Food and Drug Administration to revoke the approval of the polio vaccine used in the United States. This lawyer, Aaron Siri, has filed a petition in 2022 on behalf of the Informed Consent Action Network, ICANN, a nonprofit that challenges the safety of vaccines and vaccine mandates. Siri has been working closely with Robert F. Kennedy Jr. He was actually his attorney when he was running for president. Anyway, Kennedy Jr. is a vaccine skeptic and Trump's pick to lead the U.S. Department of Health and Human Services. He, as I mentioned, this attorney was Kennedy's lawyer during the campaign, his campaign for presidency. Now look, ICANN does all it's possible to make sure that people do not take the measles, mumps, and rubella vaccine, MMR. If Kennedy is confirmed as head of HHS, he'll oversee the FDA, and he could take a rare step of intervening in the petition review process, and he could revoke the access to the vaccine. P.S. He said that he wouldn't do that he just wants people to have choice. Well, that's a bunch of bullshit. And P.S. This guy's got a brain worm. Anyway, polio vaccination is considered to be one of the greatest achievements in global public health ever. It was once a disease. This disease actually goes back thousands of years. Anyway, it was once a disease that paralyzed and killed thousands of Americans during outbreaks. But the advent of a vaccine in the 1950s has greatly reduced the incidence around the world, putting the goal of disease eradication just on the cusp of becoming a reality. Polio wastes muscles and can easily result in paralysis and death. I don't know if you're old enough to remember iron lungs. They were invented because of polio, but they were for people whose muscles no longer allowed them to take a breath by themselves. They could not, those muscles no longer worked, and so they needed a machine to breathe for them. Anyway, in the 1950s, before a vaccine was available, polio killed or paralyzed more than 500,000 people globally every year, according to the World Health Organization. Look, when I grew up, there were plenty of people in my neighborhood in Chicago who were infected and suffered for the rest of their lives with the effects of polio. And P.S., that includes my mother. Anyway, Kennedy doesn't want people to have to get vaccinated. He has said that out loud. His inability to follow logic and his insistence on increasing personal fear over public health will create a public health tragedy of enormous proportions. Let's recall that 318,000 Americans died needlessly during the COVID-19 pandemic because they chose to remain unvaccinated. Those are unnecessary deaths that occurred after the approved vaccines were available. And if you want, there's a link to the NPR story on that, or you can go to the Lancet. Just Google Lancet unnecessary COVID deaths in the U.S. and you'll find a research report on it there. Okay, here, let's take an action, because this is something we can do. The best thing to do, really, right now, is to call your senators, both of them. I have a link you can in my YouTube description box down at the bottom. Go there and you can get the phone numbers for your senators and tell them RFK Jr. is a public health nightmare heading up HHS and don't approve him. If you want to use ResistBot, easy to do. On your cell phone, send a text message, sign SIGN space PXQREI. That's sign PXQREI to 50409. That's ResistBot. I'll read you the message. It's real short. I am your constituent, and I just learned that the anti-vaccine organization that RFK Jr. supports has asked the FDA to revoke the approval of the polio vaccine. If he heads up HHS, then the FDA falls under his control, and he can approve the petition to remove the polio vaccine or any other vaccine that he finds offensive. We cannot afford to have such a non-science based loose cannon in charge of all public health issues in this country. I want you to vote to not approve RFK Jr. for any appointment in the upcoming administration. He is a danger to public health. Thank you. Down below, you can like, share, subscribe, send comments, send me recommendations for things you'd like to see in the newsletter or things to research. You can do it here in the YouTube description area, or just send me an email at healthcareadvocacy1, all one word, @gmail.com. That's it. Have a good day.